Hi everyone. So today we're looking at a periapical radiograph of a 37-year-old patient who had CMS taken, or known as complete mouth series, taken at our school. I have already reviewed the full CMS and have noted that patient is missing rest of the third molars, 1, 16, and 17. But if you look at this area, clearly at the side of missing number 32, there is a relatively or well-defined radial opacity. So as you're taking this, what would be your differential diagnosis? And I just want to take a few minutes to kind of walk you through the process, my thought process as I'm reviewing this radiograph. First of all, I think you should all recognize that there is a radial opacity in the area of missing number 32. If you didn't even see that, and if your eyes were fixated on perhaps the margin of crowns and root apices of these erupted teeth only, we definitely need you to um, have you look at rest of the periapical radiograph. It is so easy for us to just look at the teeth that we are treating in the clinic, but yet forget to look at the rest of the radiograph. So you need to look at the overall cortical and trabecular bone of this area, and we know that from normal anatomy this area tends to appear very radiolucent, not only because of large marrow spaces but also because of some mandibular gland fossa that's present in the posterior mandible. So here we see a very well defined radial opacity surrounded by a thin radiolucent rim. And that is very important to see that. So when you see this, what are your possibilities? I mean, what are you thinking, right? And the fact that you're seeing this well-defined radiolucent rim should help you to rule out osteosclerosis. So osteosclerosis is also known as dense bone island. Essentially, it's just basically a sclerotic bone. It's just dense area in the maxillary and mandibular and any of the bone structures in bones. So those lesions, I shouldn't even say lesions, those entities will not have radiolucent rim. It will have trabecular bone that usually blend right into the opacity, whereas in this case that's not it. So you can rule out osteosclerosis. What are some other things you should consider? I think I'll try to make this as simple and short possible. The fact that this is the side of just number 32, you should always consider number 30, like perhaps malformed or root tips of number 32 as your number one differential diagnosis. Of course, you can easily ask the patient. I didn't have a chance to ask the patient, but you can first of all ask the patient whether this patient has had his or her third molars taken out, and the patient might be able to recall that not all root tips were entirely removed. So if that were to be the case, you have the answer right away. Having said that, I think that should be the first thing that we should consider, perhaps incomplete removal of number 32, hence root fragment or fragment of number 32. Besides that, it doesn't quite have the shape of the root tips, right? So it doesn't honestly look like root tips. Perhaps this could be part of this cervical third of the root or part of the crown that's left behind. So we don't know exactly. I think what we would need is a radiograph that would entirely capture this radial opacity. I think that's very important to note that before us being too confident with our diagnosis. Because what if this is not localized in the area of 32? What if this is some type of opacity extends well into the ramus that completely changes our differential diagnosis, right? So you can either take another PA of this area to get a complete visualization of this opacity, or take a panoramic radiograph so that you can see it. I think that should be our next radiographic imaging. But presuming, so there's a big assumption here, presuming that this is very well localized in this area, another thing that we should consider is odontoma. In order for me to be a little bit more definitive odontoma, I would have liked to seen radio density of enamel and some pulpal density, but those are very good, I think, differential diagnosis to start out with. You could argue that we could also consider mature stage of periapical osseous dysplasia, which I can't exactly rule that out either. I don't. But if I'm going to rank it, because it's at the side of number 32, and also this patient is, depending on how you look at it, it's relatively young, right? In 30s. So having a mature stage of periapical osseous dysplasia is possible, but less likely. So I'll leave it at that. So I think root tip or root fragment of 32 or odontoma would be a good differential diagnosis purely based on what we have here. But my recommendation is take another periapical or panoramic radiograph of this area for better visualization. Thank you very much, and I'll see you in the next video.